Health Organization welcomed the initial clinical trial results from the United Kingdom that showed dexamethasone, a corticosteroid, can be life-saving for patients who are critically ill with COVID-19. The drug does not block the virus. It works by reducing inflammation in and around the lungs, according to Dr. Michael Ryan from the WHO. Dexamethasone is not a treatment for the virus itself, he said. Rather, the drug should be seen as one part of a combination approach to treat COVID-19. Let's listen in.
And yesterday, there was the welcome news of positive initial results from the recovery trial in the United Kingdom. Dexamethasone, a common steroid, has been shown to have a beneficial effect on those patients severely ill with COVID-19. According to early findings shared with WHO, for patients on oxygen alone, the treatment was shown to reduce mortality by about 1/5. And for patients requiring a ventilator, mortality was reduced by about 1/3.
It's exceptionally important that this drug is used under medical supervision. This is not for mild cases. This is not for prophylaxis. This is a very, very powerful anti-inflammatory drug. It can rescue patients who are in very serious condition where their lungs and their cardiovascular system around their lungs may be very inflamed. So this allows possibly that patients are able to continue getting oxygen into their blood from their lungs for a very critical period by rapidly reducing inflammation at a critical period in their illness. It is not a treatment for the virus itself. It is not a prevention for the virus. In fact, steroids, particularly powerful steroids, can be associated with viral replication. In other words, they can actually facilitate the division and replication of viruses in human bodies. So it's exceptionally important in this case that this drug is reserved for use in severely ill and critical patients who can benefit from this drug clearly.
The benefit was seen in patients who are on oxygen therapy, so who had already lung injury, or those patients that were on ventilation. So there was no benefit seen in the patients that had mild disease. So this study was not for prophylaxis. So I think that is the take-home message as you've described, Mike.
It is one, but of the many breakthroughs we're going to need in order to effectively deal with COVID-19. And as such, we should celebrate that today. But it's still just preliminary data. It's from one study. It's very significant, but we also have to see the real data, the full data, and we thank our colleagues in the UK for briefing us, but we still obviously, and they will be working very hard over the coming days to release detailed data to get this published in peer-reviewed journals, so everybody can see what the results are.
Researchers led by a team from the University of Oxford administered the widely available drug to more than 2,000 severely ill COVID-19 patients. And among those who could only breathe with the help of a ventilator, dexamethasone reduced deaths by 1/3 and by 1/5 in other patients receiving oxygen only, according to preliminary results. Normally used to treat a range of allergic reactions, as well as rheumatoid arthritis and asthma, dexamethasone is an anti-inflammatory. The team said daily doses of the steroid could prevent 1 in 8 ventilated patient deaths and save 1 out of every 25 patients requiring oxygen alone. The trial, carried out by the Recovery Research Group that is searching for effective COVID-19 treatments, included a control group of 4,000 patients who did not receive the drug. However, the trial showed dexamethasone to be ineffective in treating patients with milder forms of COVID-19.